Hello everyone, I'm Byong Cho, CEO and CTO of ExoCoBio. It's my honor to share my knowledge on exosomes today. Today's topic would be science and standardization of exosomes. When we talk about exosome, I usually start with these 9 questions. When you see any exosome company and technology, you can make these 9 questions. Number one, the investment. Actually, ExoCoBio is the biggest investor for exosome R&D manufacturing of more than $75 million for last 7 years. And that's why we have the biggest exosome GMP manufacturing facility of $30 million. And the most important thing is that ExoCoBio has 17 scientific publications on clinical studies or non-clinical studies. Also, one of our missions at ExoCoBio is to cover or the dermatological applications based on innovative discoveries. That's why we have the biggest number of patents of more than 56 patents, including 8 US patents. Also, for last 4 years, since we launched our exosome product, we have been generating more than 1 million cases, which means that our technology and products have been proved in practice in terms of efficacy and safety. Well, ExoCoBio has 2 kinds of business. The first one is regenerative aesthetics, and the other is exosome-based biomedical business. Now you are seeing our brand new Exo GMP manufacturing facility to develop exosome-based regenerative medicine. In this facility, we can produce IV injection grade exosomes very soon. So these days, exosome therapy is the most favorite new treatment for skin rejuvenation. And you can see that this exosome therapy started from South Korea. Here you can see the K-beauty treatment. Here K means Korea. And everybody in the world is becoming aware of the potential and the efficacy and safety of exosomes. In terms of scientific publication, you can see that more than 26,000 publications for all kinds of exosome research on PubMed. And actually, you can see that in this Google trend, you can find that more and more searches have been made for exosomes for last more than 20 years. When we talk about exosomes, you can see top 2 global exosome scientists. On the left side, you can see Dr. Sai-Kang Lim. She discovered stem cell exosomes for the first time in the world. So she is like a mother of exosomes over the paracrine effect of stem cells. And on the right side, you can see Dr. Jan Rotteberg, who is a Swedish MD PhD. He discovered RNA transfer mediated by exosomes. And his publication has more than 12,000 times citation. So what is real exosomes or extracellular vesicles? You are seeing that this is the main function of exosome. They are supposed to deliver or exchange important messages or information between our cells. So when you have a very important message or information, you are supposed to package the information to be delivered. And here and at ExoCoBio, we have been focusing on stem cell derived exosomes Here, stem cell means human mesenchymal stem cells and plant stem cells too. So the average size is 100 nanometers. They are very different from traditional molecules or cells. Actually, one of the biggest advantages of exosomes is that because of their size and their composition of the lipid biomembrane, they are very easily uptaken by our cells, and they can penetrate deeper into our skin over time, as you can see here. And this transdermal delivery can make our product as a topical product or minimally invasive product. You can combine with our product or exosomes with a variety of clinical medical devices in your clinic. For example, our microneedling is one of the best combination for transdermal delivery. Here, main topic would be like standardization of exosomes. There are so many types of exosome from so many manufacturers out there, but here you are seeing the world's largest GMP manufacturing facility located in South Korea for exosome production. In this building, we are standardizing the manufacturing process to produce injectable grade and lyophilized exosomes. The Korean FDA recently granted the manufacturing license to ExoCoBio, and we have been investing more than $26 million for the last 3 years. In this ExoGMP manufacturing facility, we usually start with a lot of stem cell culture, and those cells are releasing a lot of exosomes into the conditioned media, and we isolate purified exosomes from a series of filtration named tangential flow filtration, TFF, and we do fill finish into vials, and we control the quality. Actually, ExoCoBio has been developing a variety of cell sources. You can see that the first one is human adipose stem cell exosomes. We can use those human stem cell exosomes for regenerative aesthetics. The countries, including US, Japan, Korea, we are allowed to use those human adipose stem cell exosomes. But our second pipeline is plant stem cell exosomes. As you can see here, all of the countries, including European countries, are allowing to utilize the potential of a plant stem cell exosome. So our first project in this kind is the rose stem cell exosomes. And in addition, we have two different type of exosomes like microbial exosomes or animal, for example, canine mesenchymal stem cell exosomes. And all of these, or most of our exosomes are registered as a cosmetic ingredients in the United States or in European countries. I mentioned that we usually start with a lot of cell culture. So we can do any kind of cell culture here, and for example, after this cell culture, we get conditioned media, and especially in this conditioned media, cells are releasing exosomes during the culture process, and the amount of exosomes is just like 0.5% of this total conditioned media. So there is a big difference between conditioned media and pure exosomes. And you can see that conditioned media are regenerative, but they are pro-inflammatory and they are full of high impurities. So to isolate purified exosome, we need to filtrate, or there are several kinds of technologies which can be used to isolate exosomes. But in terms of purity and the cost or production yield, we are focusing on very special type of filtration. And then after this process, we could isolate purified exosomes. So this is the simple process or simple representation of tangential flow filtration. So we are combining the traditional tangential flow filtration technology in combination with our proprietary improved manufacturing process. We call this ExoCoBio manufacturing technology. So after this production, you can compare the condition media against our purified exosomes. And then you can see that there are a lot of impurities, unknown factors, something like that. But in our product, we are based on purified exosomes in addition to other ingredients to create synergistic effects. The manufacturing process of our ExoCoBio patent, they are fully compliant with the guidelines of the International Society of Extracellular Vesicles, which is the biggest exosome scientific community. Also, our manufacturing process is compliant with the guidelines of the Ministry of the Food and Drug Safety, which is kind of the Korean FDA in South Korea. After formulation and production of our finished products, we have set up a lot of quality control tests and analytical methods. We can identify our exosomes from this electron microscope image, and we can do protein analysis or biomarker analysis. We can check the size and number of exosome particles, and our exosomes can be uptaken by human dermal fibroblasts, for example. They are delivering important messages after this cell update. So here, please let me share some information on exosome-like products. Maybe some of you guys know that in the United States, the US FDA sent out kind of warning letters to general public. And actually, at present, in the United States, there is no exosome drug. There is no exosome medical device. But we can utilize exosomes based on human adipose stem cells or mesenchymal stem cells or any kind of exosome plant stem cells. They are recognized as cosmetic ingredients for now. So we have very strong freedom to operate for our exosome-based regenerative asset business. There are 4 kinds of exosome-like products, as you can see. They have different sources. The first one would be a synthetic one, but when you look at the ingredient list, exactly, you could see that there is no stem cells or there is no actual exosomes. They are just kind of mixture of collagen or polynucleotide, something like that. And the second exosome-like product is derived from blood or PRP. But blood-derived products contain a lot of lipoproteins because the size of lipoproteins are very similar. It's very similar to that of exosomes, and then they cannot be usually separated from exosomes. So they are full of lipoproteins. And the third exosome-like product is fruit extract. Most companies crush the whole fruits or plants to have a juice. And in their juice, there are a lot of impurities or unidentified material or antioxidants, something like that. And the fourth exosome-like product is a conditioned media. And conditioned media was a great technology before exosomes, but you can see that they have a high impurities and they are mostly pro-inflammatory. So let's look at them one by one. So some people say that there are synthetic exosomes on the market, but which is not true. You can see the ingredient list. They are kind of hydrolyzed collagen or polynucleotide, etc. For example, you can see that in this ingredient list, they are only collagen, hydrolyzed or non-hydrolyzed, or sodium hyaluronate HA or trehalose, and or growth factors or peptide. So here, synthetic exosomes means nothing. It's not exosome products. It has no extracellular vesicles. It's a kind of a chemical mixture. Also, in the blood, as I told you, you can see that in this electronic microscope image, you can see that there are only two exosomes, but they have a lot of lipoproteins, more than 100 times than the actual exosome. You can see that their sizes are very similar and they cannot be easily separated. When we try to separate these lipoproteins from these exosomes, we need to consume very high cost actually. And here again, you can see that you need to differentiate from conditioned media from purified exosomes. Here is a fruit or vegetable extracts. They are not actual exosomes. Fruit extracts have nothing to do with the exosomes. Again, here you can see the ingredient list. There is no exosomes. One publication, here you can see that they are talking about antioxidant contained in exosomes, but they have no information on microRNAs or proteins contained in exosomes at all, actually. So I think we have to be very cautious when we talk about exosomes. Actually, our product or our technology is the only product who registers or who can show the ingredient list. As you can see here, we have one rose stem cell derived exosome. So here you can see the rose damascena callus extracellular vesicle. Here callus means stem cells. So we are the only company who has purified plant stem cell exosomes as an ingredient list. You can compare our product labeling against others' product labeling here. In summary, our manufacturing process can generate purified exosomes. They are only real exosomes on the market, I believe. As I mentioned, that our exosomes are registered in the United States and in European countries, especially you can check the INCI name on the website. We are the first who achieved this kind of patent on any kind of plant stem cell derived exosomes. Here, let me go into the details on our large stem cell exosomes. We were successful in isolating stem cells from these kind of rows, and when we culture, they are releasing exosomes, just like human stem cells. And when we treated those plant stem cell exosomes to human stem cells or human skin cells, they are responding. They are responding to release more exosomes, which means that in those stem cell exosomes, there are many information to be delivered to make our cells to produce more exosomes. And when for last years, we have done a lot of in vitro assays or in vitro analysis. As you can see here, the average size of exosomes of those stem cells is just like 100 nanometers. And from this electron microscope image, you can see that the spherical shape and lipid bimembranes, like human stem cell exosomes. Also, large stem cell exosomes can be uptaken by human donor fibroblasts, and they could induce more collagen production for our skin rejuvenation. And when we treated large stem cell exosomes to a melanocyte, they could prevent the synthesis of melanin, which means that anti-melanogenesis effect. And one interesting finding from ExoCoBio is that those stem cell conditioned media, they are a bit toxic at high concentration, while those stem cell exosomes are mostly non-toxic to our donor populace cells. When we profile the microRNA contained in our large stem cell exosomes, we could see many types of microRNAs, and some of them are shared by human stem cells. Here, for example, we could see a variety of types of LET7B or LET7 family microRNAs. They are very famous for anti-inflammatory or anti-cancer effect. And you are now seeing that top two most abundant microRNAs contained in large stem cell exosomes. They are related to cellular proliferation or housekeeping function. So we are trying to do more analysis or more research to find the mechanism of action, but generally speaking, they have dual functions. The first one is regeneration, and the other is immunomodulation. Here you can see that a variety of pro-inflammatory cytokines or pro-inflammatory conditions were downregulated by the treatment of our exosomes from animal study. Now you are seeing that some clinical cases. As you can see here, our products are very effective for kind of wound healing, like skin regeneration, and then they are very effective to improve skin conditions. And I appreciate this case, Dr. Lydia, Poland. She helped this patient. This patient suffered from a serious problem from her autologous skin graft in the middle part of her face 30 years ago. And to improve these skin conditions, Dr. Lydia performed microneedling with our products. And after several sessions, you can see that the reduction of hypertrophic scar and the reduction of the blood vessels, something like that. And we have another product named ExoBomb to help this kind of patient. So Lisa, breast cancer survivor, she has a lot of pains and bleeding blistering from this radiation burns. And topical application with our ExoBomb could help her skin condition, and her pain was diminished a lot. And we have generated a lot of clinical cases for scalp rejuvenation or hair growth. Here you can see that one doctor in Poland could see a nice hair growth from the treatment of our product. And now we are trying to launch another product for intimate rejuvenation. The mechanism is all the same. We are focusing on regeneration in addition to anti-inflammation to create synergistic effect for our intimate areas. So our technology and our products can be used for example vaginal dryness. I hope you can enjoy our product in the near future. And please be aware of unauthorized our products in Poland. Some distributors are selling without any official authorization. Please check this tag or labeling on your product to choose the right product in your country. And as I mentioned that on the product labeling, you can check the exact name of our ingredients from large stem cell exosomes. Okay, please remember these 9 questions to choose the right technology and the right product and the right distributor like Imedis. And one of our projects at ExoCoBio is to develop another type of exosomes. We call this as engineering or engineered exosomes to develop a new immuno-oncological therapeutics based on exosomes. So we are trying to make genetic modification to attach cytokines like interleukin 12 on the surface of our exosomes, and they can be delivered into a cancer microenvironment to promote anti-cancer immuno-oncology. So anti-cancer immune system to suppress cancer cells. Thank you for real listening, and I hope you can enjoy our technology and product with Imedis in your country. Thank you so much.